The topic is ectopic pregnancy. First, it's important to understand how a normal pregnancy occurs. During a normal pregnancy, an egg is released from the ovary and travels down the fallopian tube where it meets a sperm and becomes a fertilized egg. This fertilized egg then travels down the remainder of the fallopian tube and implants in the uterine endometrium. It's important that pregnancies are able to implant in the uterus because the uterus can expand as the pregnancy grows. In contrast, an ectopic pregnancy is a pregnancy where the implantation of that fertilized egg is not inside the uterus. Most commonly, this is when it implants in the fallopian tube. When the egg is released and meets the sperm, the fertilized egg cannot travel the remainder of the fallopian tube to reach the uterus. The reason why the ectopic pregnancy gets stuck in the fallopian tube usually has something to do with fallopian tube damage. This can be due to scarring from a pelvic operation, but more commonly is due to something called pelvic inflammatory disease, which causes inflammation and infection of the fallopian tubes such that they scar over and won't allow the fertilized egg to travel to the uterus. Now, when a woman becomes pregnant, she doesn't know the location of where that fertilized egg has implanted. The only way to tell the location of the pregnancy is by ultrasound. As I mentioned, a normal pregnancy implants inside the uterus, which can grow as the pregnancy grows. However, an ectopic pregnancy that implants in the fallopian tube as it grows, will stretch that fallopian tube, which is not a muscle and not meant to contain a full pregnancy. This causes stretching of the fallopian tube, which can usually lead to pain in the abdomen on one side because only one fallopian tube is affected, and abnormal vaginal bleeding or spotting because as the pregnancy expands, it causes stretching of the tube and bleeding that leaks into the uterus and out the vagina. During an early ectopic pregnancy, the woman might have a home pregnancy test that's positive. However, she doesn't know that the pregnancy is actually outside the uterus. Therefore, she may think that the pregnancy is proceeding as normal. Ectopic pregnancies may be asymptomatic for weeks. That is, until the pregnancy outstretches the ability of the fallopian tube to contain it. This causes the tube to rupture, and we call this a ruptured ectopic pregnancy. Because the symptoms of an ectopic pregnancy can be subtle until the fallopian tube ruptures, it's important that every woman who comes to the emergency department with abdominal pain have a pregnancy test performed. Because there is so much blood flow going to the fallopian tube and feeding the pregnancy, any rupture in the fallopian tube can cause massive amounts of bleeding. The bleeding pools inside the belly, and we call this hemoperitoneum. Patients with hemoperitoneum are in a lot of pain. Usually, this can be referred pain up in the shoulder, but commonly, it's pain on one side of the abdomen. If the bleeding becomes severe enough, it becomes a hemorrhage, and patients develop signs of hypovolemia, like tachycardia, a fast heart rate, and hypotension, low blood pressure. This becomes a medical emergency. There are two ways to treat an ectopic pregnancy: medical or surgical. Medical treatment for an ectopic pregnancy is with a medication called methotrexate. Methotrexate is a chemotherapy drug that stops the division of rapidly dividing cells. Because methotrexate is a chemotherapy drug, a woman's urine can be toxic for up to 72 hours after administration. As part of medical treatment, it's also important that we are able to manage the woman's pain. We do this with analgesics, but tend to stick to medications no stronger than acetaminophen because we don't want to mask any abdominal pain that might be a sign that the ectopic pregnancy has progressed to a ruptured ectopic pregnancy. Methotrexate may not be an appropriate treatment for all women with an ectopic pregnancy. Depending on the size of the ectopic pregnancy and the patient's status, surgery may be required. And because a ruptured ectopic pregnancy is a medical emergency, immediate surgery may be indicated.